Hello, everybody. We'll get started right away. 124 people actually signed up for this webinar, so I'm sure people will be filtering in as we go along, but we want to get started right on time. Hello, and thank you all for joining this, which will be the first in a series of webinars that we'll be presenting on all aspects of the National Trauma Research Repository. All of our webinars will be recorded, and we'll make them available on demand on the center website as well as on the NTR site itself, so you'll always have access to them. My name is Pam Bixby. I'm Deputy Director of the Coalition for National Trauma Research, and I have served as the overall project manager for the National Trauma Research Repository project that we've been working on the past 2 years. We're really thrilled that you're taking the time out to learn how to take advantage of this free resource and learn how to help us grow it for the benefit of the whole investigator community and ultimately for trauma patients. I have a couple of housekeeping notes before we get started. First of all, we're muting everyone during the course of the presentation. So if you have questions as we're going along, please put those in the chat. I'll keep an eye on the chat and I'll raise those questions when we get to the start of the Q&A portion at the end. And then at that point, we'll unmute everyone and allow for additional questions that you might have. And if you can please use that raise hand function, that will help Nick answer questions in an orderly manner. So let me introduce your presenter for today, Nick Madrano. Nick is our NTRR operations manager. He's been in the thick of it the last 2 years, working with dozens of subject matter experts to identify and specify common data elements that you'll find in the NTRR data dictionary. He's also responsible for facilitating the data submission and data access functions of the system to make sure users have a smooth experience in that backend. And he works with his counterparts at the NIH to make sure the NTRR is interoperable with the FITBR information system. So he'll be your expert guide through the system today. And with that, I'll turn it over to Nick.
Thanks, Pam, and thank you again, everyone, for joining today. As Pam stated, we are going to be releasing quarterly webinars. So this is the first one. So this is a very introductory webinar into the system as a whole. Today we'll essentially be going over what the NTRR is, how you could use it, and then if you feel like it has use to you, what kind of account types do we have, and how would you submit a request for that specific account type. And then I will have a demonstration at the end to kind of show you the site and the basics for how you would apply for an account. And then as Pam said, if you have any questions, go ahead and put those in the chat, and then we'll have a Q&A at the end. So for today's kind of agenda, we'll start by very broadly talking about the NTRR as a whole. I believe some of you are familiar with it from working on some of our work groups. So we'll kind of circle back and give you a very broad overview of the NTRR system. From there, we'll go into the different NTRR environments, which are where the data will live in the NTRR. We have 2 different locations, the data repository as well as the meta study. After we talk about that, we can get into the different types of accounts that you can apply for, whether that's a data access account or a data submission account. And then I'll give a demo at the end that will go over how you would apply for account, as well as we'll finish up with, as I said, a Q&A. So first, what is the NTRR, or National Trauma Research Repository? It is funded by the Department of Defense, hosted by National Institutes of Health, and then managed by the Coalition for National Trauma Research. So myself and Pam work for the Coalition for National Trauma Research. We call it Center. So this has been quite the project that's brought together a lot of stakeholders, both military and civilian, in order to create such a great resource that can be used by both the military and civilian world. So the NTRR, as Pam briefly stated, is a free resource for trauma research community, and it enables sharing of subject level de-identified data. So the repository has just gone live here in the past year, and the idea is that moving towards the future, it will be a central warehouse for housing trauma clinical research data. Once again, whether that's military or civilian, and regardless of what the funding mechanism is. The reason that this resource was developed is to support new emerging data sharing needs. So, as many of you are aware, if you are submitting for a grant, a lot of times it's required now that you have a kind of a data sharing plan, and there's somewhere that your data is going to live for others to be able to use it, analyze it, and potentially aggregate it with other data sources. So that's kind of the purpose of the repository, is allowing you to have somewhere to put that data, as well as, of course, then promoting the collaboration. As the system grows, we'll get more data in it, and then you'll be able to aggregate data in the system across studies and then complete meta-analyses. The NTRR does use specific common data elements, or CDEs, which I'm sure many of you are familiar with. And these are standard definitions and permissible values for data elements. So very specifically defined elements. And then in regards to how that element can be collected, very specific limitations and very specific ways in which the data is collected. The idea being that if we're all collecting data in the same way across our studies, that's going to make it much more easy to aggregate data on the back end. A common question that we get from researchers is, what's the difference between a trauma registry or a data registry and this repository, the NTRR? So I like to just kind of start by talking about the difference between those two. I'm sure many of you have worked with, TQIP or NTDB, which houses a very standardized clinical data set, right? All the institutions collect the same very specific data points in the same exact way. And the repositories like to do that as well, with collecting data in the same way, but specifically the NTRR houses research study data. So as you can imagine, if you have a research study, the data that you might collect is going to be much more varied than what we would see with the standardized TQIP data set, right? While the registry data is, extremely valuable, it's a little limited in what it can collect. So the repository would be a location where then you could house your specific research data with much more specific and varied data points. And then the repository also has the ability to support the submission of analyzed data sets. So if you were going to do a retrospective study and pull data from the data registry, you could potentially then house that data inside of the data repository. So, why use the NTRR? So the NTRR isn't yet, it's not required to use in any way currently. And it does take a little bit of effort to get your data into the system. So what's, in it for the researchers? So first of all, increasing the visibility of your work. When your data would get submitted to the system, we would have a 12-month embargo period, and that would allow you plenty of time, as you're submitting the data, to do your own analysis before allowing others to gain access to it. Um, your study data set would be a DOI would be created for it, right? That would be unique. It would be a separate DOI from, let's say, a DOI that would be assigned to a journal publication, right? You'd have one specifically for the data set that others could cite. And then, of course, then you have the ability for secondary analyses for data. So other users can then use your data, at which point Center will help amplify the use of your data set once it's been submitted to the system. As I mentioned, second, fulfilling data sharing requirements, right? Many academic journals, as well as the funders, now require investigators to implement a data sharing plan. So this would be a great place for the data to live, and we can also help you kind of develop that data sharing plan to include um, in your grant application. And currently, as I said, the submitting data to the NTRR isn't required. However, it is anticipated that in the future, the DoD funding calls may require your data submission to go to the NTRR. In a mention, I'll talk about the TBI specific repository, and that's how that TBI specific repository is currently set up. Is it's required to get submitted to the repository. And then finally, the reason that we're all doing research is to, contribute to the advancements in care, identifying research gaps across the continuum of care. So the idea is that if we have all of this data housed in one location, we'll be able to really take advantage of those data sets by aggregating them and making them more powerful and finding those research gaps and improving outcomes. So lots of reasons for you to use this, once again, free resource to house your data. The NTRR uses a system platform called BRICS. It's the Biomedical Research Informatics Computing System. All the other repositories listed here on this page use this same platform, which is a web-based platform that has many different modules that you can literally do your entire study in the brick system if you want to, from beginning to end. Of course, we understand that many of you are used to using your own data capture systems, and you can by all means use those. But this system, it has been kind of widely adopted as a system where you can both collect your own data or just submit data once you have collected it using your own data capture system. This system here, FitBur, is the TBI specific repository that's been up and running for over 10 years now. And any DoD or NIH TBI funding, those grants are required to submit their data to FitBur. So all of those data sets exist in FitBur, and there's a ton of data in there already. So because that system is trauma and it's just TBI specific, when the NTRR was developed, it was developed as kind of a sister repository. So both the FitBur TBI specific repository as well as the NTRR are existing together, where you'd be able to aggregate data across the two studies, as well as adopt common data elements that are used in either of the repositories. So they're kind of existing together in one repository, where essentially you can filter, but you can filter between the two, the data sets, the studies. I'll talk a little bit more about that, but because this FitBur resource has been so successful and it has, as I said, over 10 years of data in it, it makes sense for us to be able to use that data since we are still working in trauma. So both of the repositories, as well as any bricks instance, uses common data elements, so CDEs. And those are just standardized definitions, permissible values for elements. Once again, the idea is that if researchers are using a standardized data set and we are being standardized in the way that we collect the data, then that's going to enable more data sharing and better meta-analyses on the back end if data is being collected in a consistent manner. Now, we do understand that there's the potential that, a potential limitation to using CDEs is that if you have a very particular study and you are interested in collecting very specific data points and CDEs don't already exist for those data points, right? Then what do you do? Well, the researchers would have the ability to create what are called unique data elements. And those data elements are essentially filling the gaps for where no common data element exists. And the idea is that if that unique data element is created by one researcher, and then another researcher comes along and it actually would work for them as well, and we see that that element is being adopted by the research community, then we can kind of upgrade it and say, and take a look and make sure that it is, optimized for data collection for many studies, and we can then create a CD, upgrade it to a common data element, and then that way it's easier to be more widely adopted by others. Over the past couple of years, we have worked to create common data elements. The FitBur system, of course, has many because it's been live for so long. And then over the past 2 years, we've been working specifically for the NTRR to create common data elements. So I have a link here for those. I'll show you guys those as well when I go through the demo, and I can show you the site where you could look at those and see what those are. Over the past 2 years, we created many work groups that helped us of subject matter experts, trauma surgeons, burn specialists, data scientists, social scientists. And we've created multidisciplinary work groups that have helped us identify what common data elements should exist in the NTRR and then how they should exist, right? What should the definition be for things like race and ethnicity and so on? So currently, there's around 280 or so common data elements that have been recommended for adoption by these groups. These groups did a literature review and then a three-round Delphi survey to identify and come to a consensus on which elements should be created. So this is, kind of just the beginnings. Around 300 elements. FICPR already has, of course, thousands of elements because it's been live for so long. So the idea is that this is something that will continue to grow as users use the system and we can see what's commonly collected. Section 2, so that's kind of an overview of the NTRR as a whole and how it's structured and kind of what we've been working on so far and how it's been developed. Now I'm going to go into some of the environments that are going to house the data. So the brick system is naturally, any brick system is built into these different modules. So you can see there's quite a few here. The idea with our webinars is that as we move to the future, we will kind of go more in depth into these modules. But for today, we're really going to focus on the two modules that would house the data and the difference between the two and how you would use them. So those two modules are what we call just the data repository proper and then the meta study. So both of these locations can house data, but it really depends on what type of data we're working with for where that data would live. So to kind of compare the two, the data repository focuses on data sets from prospective studies that utilized and adopted those CDEs that I was mentioning. So if you have a study and you have, you have your own CRF and you have kind of aligned your elements in your CRF with the existing elements in the system, then the idea is that data would then get submitted to the repository. And as researchers align their studies with these CDEs, more and more data sets will exist in the repository. And then that allows for data to then be aggregated, right? If we have many studies that are collecting the same things, then we can build larger data sets. The second environment is the meta study, and that houses already completed studies for what we're kind of referencing as legacy studies. So that would be a study that's, let's say, already completed today, right? If you didn't have the ability to adopt the CDEs because you didn't know about their existence, then you can still submit your data to the NTRR. It's just going to live in this separate environment known as the meta study. So, or if you were doing a retrospective study and you say wanted to analyze TQIP data, right? Where could that data live? That data could still live in the NTRR. It would just live in the meta study environment. So it can also house meta-analyses from aggregated data from the data repository. So as the data repository grows, then researchers can go and see what type of overlap there is between studies and then aggregate that data and then essentially create a new data set. And that data set then would live in the meta study. So those are the different environments. Now that you have an understanding of the environments, I'm going to go into what are the different types of accounts that you can have, what are the different ways that you can use the system. So there's two account types really. There's a data access type, account type, and a data submission. They're just like they sound. Data access would be if you wanted to just access data that exists in the repository and do some type of analysis of the data. And a data submission would be you're trying to submit your data, whether that data is being submitted to the data repository or the meta study. You would still apply for a data submission account. This is to ensure that users are only having access to the components of the system that they're going to really need for security purposes. There is quite a process of making sure that we are looking at how the users want to use the system and ensure that they're using it properly. So I'll kind of get into that a little bit when I give the demo on how you would apply for an account. So these are the two main account types. For data access, This would be as it sounds, accessing data. You'd be able to access data in both the data repository or data in the meta study. And then you'd have the ability to use another module, the query module, in order to query the data and try and find data with specific elements that you're looking for, and then aggregate that data. So the idea of just a kind of a basic workflow for a data access account would be you would look at the data dictionary to see what data elements exist that you're interested in looking at. You could then go to the repository, and that's where all of the studies would live. And then you could query that data in the repository to see what aligns with that specific, those sets of elements. And then you would then have a new data set where you've now combined data from different studies, and then that new data set could live in the meta study where you could then, complete further analyses. So that's the basics of a data access account. For a data access account request, first of all, we're working with our programmers to put a public list of all the data that's been submitted to the system. So that way you wouldn't even have to get into the system to see what data exists. So we're working with them currently to build a table that looks something like this, where you'd be able to see who the investigator was, what was their funding source, what was the title of their project, and then an abstract for what their project is about. And then the idea is that users would be able to look at what data exists in the NTRR. And then when you're submitting your request, you would say, hey, I'm really interested in these data sets from these studies. This is what I'm interested in doing with that data. So users that would be interested in gaining an account to do something like that, you would submit a data access request form found here, and then that's where I'm going to give a demo over kind of that process of what you would do to submit that form. For data submission, right, submitting data, this would be whether you're submitting data to the repository or the meta study. Once again, the data repository would be if at the beginning of your study you wanted to align your CRFs with the CDEs that exist in the system, then your data would eventually end up in the data repository. And then if you already had a completed study or a retrospective study that did not utilize the CDEs, right, we could still hold that data. That data would live in the meta study. And then, as I mentioned, for a data accessor, right, if you completed your meta-analysis, then you would then that data would then live in the meta study environment. So for a data submission request, you can find a list of the existing NTRR CDEs on our site. So that's linked here. I'll also, during the demo, show you guys how to get to that. So that shows the results of all of those work groups that completed their Delphi surveys in order to come to a consensus on what CDEs should exist in the system. So you can see what those are, and then you can potentially, align those with your study to ensure that we're collecting data in the same way. And then for that type of account, you would submit a data submission request form that's found here. Once again, I'll show you that during the demo. And then that being said, I'll jump right into the demo. If you do want to just check out our site, it is ntrr.nih.gov. So that is also just linked here directly in this slide deck, which of course we will be sending out to those who attended today. So that's a link there. We'll take you to kind of the home page. The home page is going to just give you an overview of a lot of the information that I've been sharing with you today. Really just, the very basics of what the system is and how you would use it. If you do go to the data tab, you can look at things like the data dictionary. So currently, because the FitBur system as well as the NTRR system kind of exists together, currently we have all of the published data, common data elements from both existing here. This is another thing where we're working with our programmers to allow you to filter between the two. Make it super easy to just kind of click a button here that says, I just want to look at the NTRR CDEs, which is a couple hundred. And then you could export them and then try and align them with your study. So that's here, the data dictionary. We also have currently, if you were just interested in those results from what came out of those work groups, right? We have a list here with the different tabs of those different work groups from those, different environments. We had pre-hospital specific, acute hospital, which focused mainly on the ED, outcomes and rehabilitation, and then also social determinants of health. So these work groups specifically focused on their environments and elements that would make sense for adoption in their environments. So if you click on any one of these, there'll be a table that shows what those variables are, and then you can also just download them here as a CSV if you're interested in identifying, oh, I'm doing a pre-hospital study. Let's see how I could potentially adopt some of these elements. As you can see, it's not a lot. It's overall between all of these work groups around 270, 280 elements currently, with the idea that once again, as researchers submit data, this list of common data elements will grow. So that's kind of the data tab. The other main tab you guys will be needing is the Get Started tab. I will say that at the bottom, we do have some videos and training already available for you. So if you're someone who really likes to, let's say, read about things, right? That's how you like to learn. And we do have user guides that are more in text format. The only thing with these user guides and videos and trainings is that they're specific to bricks as a whole. So as I mentioned earlier, there's quite a few repositories that use the bricks system, and these trainings and videos are essentially for any bricks repository. The idea over the next 2 years as we come out with these webinars, as well as just providing assistance to users, is that we're creating content that's extremely specific to the NTRR to just make it as easy as possible for users to adopt and use. So those resources are there for you. Today, we're really just going to focus on getting an account because that would be the first thing that anyone who's interested in using the system would need to do. So there is a kind of workflow here of the process. So as well, if you're someone who likes to just kind of read over things, that's here for you. Um, I'm going to just really give you a demo in the simplest form of what you need to do. The first thing that all users need to do is to set up your researcher auth service account. So if you're NIH, right, this would be your PIV card. You're already good to go if you have a PIV card. Or if you're DoD, you can use your CAC card. So if you have one of those cards that you are just used to using every day to log into your computer, you're kind of already done with step one. If you don't have one of those, then you'll just need to create a login.gov account. A lot of you, I'm sure, have a login.gov account because you're used to doing, research. But if you don't have one, that would just be the first thing that you need to do. And then that's the kind of initial setup. So either having your card or creating a login.gov. So once you do that, you can just come to the NTRR site here and go to login once you have one of those set up. So you'll just go to login. You'll log in with your RAS. And at that point, it's going to be, okay, do you have a card or do you need to use a login.gov account? So I'm not NIH or DoD, so I will log in with my login.gov. And I have a dummy account here. What this system is going to do is if it recognizes that this account doesn't have an NTRR account, right? You're putting in your login.gov information and it recognizes that information as not having an NTRR account, is it's automatically pretty much going to send you to where you need to create an account. So it did send me that text link, right, that we're used to now using these days for security purposes. So it sent me that code to my phone. I'm going to submit that code. And now, because it doesn't recognize that particular email account with that login.gov, it recognizes that and it's like, oh, you don't have an account. Let's create an account for you. So here you'll just create an account. And then from here, as I said, because the FITBR and NTRR systems live together, Um, you'll see there's kind of Fitbit branding here. And by default here, let me actually zoom in a little bit for you guys. You'll see by default, it's just the first thing that we need to tell the system is what primary resource are you interested in using? Are you interested in just looking at TBI specific data, or are you interested in using the NTRR? As I said, you'll have access to both data sets. This is for us to understand, primary users, because primary NTRR users will, I will be your, guide and help you whenever you need assistance. Compared to if you're a Fitbit user, there's a Fitbit team, right, that's going to be assisting you. So you'll just need to make sure that you select the NTRR here as the system that you're going to be using primarily. It does list the account types here, which I've gone over with you all already. This pretty much just kind of reiterates that information and talks a little bit more specific about what permissions you would have, depending on which account type you apply for. And then the what you're required to submit for your request is a biosketch of whoever is wanting access to the system. So that could be whether it's you, the PI, or it could just be if you have, let's say, a research assistant who they're going to be the ones who are actually going into the system and submitting the data and dealing with all of that. They would be the ones who would be filling out this information. So they'll submit a biosketch. And then here are the files where you have access to whether you want a data access account or a data submission account, right? The ones that we talked about. So I'm just going to click on one. This is going to let you download a PDF that you can either fill out electronically, or you can print it out and, write on it and then send in a copy. So here's an example of the data access request form. Because the systems live together, you can see that it's kind of co-branded Fitbit and NTRR data access request, because you're going to have access to both data sets. Mainly, this content here is regarding kind of use, restrictions on how you're going to be using the data, as well as how you will gain access to the system. There are, really it's a terms and conditions, right? This is going to be research specific data, right? It's not going to be used for commercial use. All the data that you're going to be either pulling or submitting is non-identifiable subjects. It's non-transferable data. I'll get in a second. You can have some users that gain access to the data. Um, and then really just a terms of use that you're signing. So here's all that terms of use, best practices, as well as some security standards for you. We do want to make sure that because the data is de-identified, but because it is subject level data, we want to make sure that the data is secure. So some good standards here for you while you are accessing the data. And then it comes down to, okay, information about the user. So you'll put, what resource are you using, your name, your institution, a brief description of your research project. And then we do need a signing official from your institution. So normally you have, an office of sponsored research of some kind. If you need help finding out who that would be at your institution, you can reach out to me, or there's also this link here that can help with that. So we do need essentially someone from your institution signing off on the project for what the project is, and how the data will be either submitted, or what data will be used. Um, so this information here is for the user that's going to have access to the system. And as I said, that may be the PI, or it might be, a research assistant. So here we ask for the PI contact information if it's different from above. So it may be the same, may be different. So that's their information for the PI. And then here is more information about the project itself. So here's where you would write up a summary abstract of, because this is a data access form, you would write up I'm interested in, analyzing this specific data, and this is what I'm interested in doing with the data. Um, it doesn't have to be super specific, It can be broad if you are, let's say, interested in looking at specific data sets because you think it might have data that you might be interested in. That's perfectly fine. We do have a data access committee that's essentially going to review this document and ensure that it's being used for the right purposes. You do have the ability down here to add more senior personnel. So these will be people who won't have necessarily an account in the system, but they will have the privilege of looking at the data and analyzing the data. So we have the ability to add 3 additional users here at the bottom for other, collaborating investigators. By all means, if more than one of these investigators wants to gain access to the system, essentially we could just make a copy of this and we would need to just update this information to ensure that each individual is having their own account to the system. Even if it's for the same study, right? If multiple people for that study want access, then we are going to need separate forms, one for each user. So here is, I just went kind of back to this where account management, where it's the system's going to automatically send you if you're a new user. So down here, you would submit your files, right? You'd upload your supporting documentation. So that would be your biosketch and then either your data access request or data submission request. So you would attach those files here, and then you would upload them. Just click upload, and then you would hit, once those are attached, you would hit continue. I'm just hitting OK, it's just giving me a dialog box because I didn't attach 2 files. And then here's where you're just going to actually create your account. So you create your own username. You put in your contact information. This would be the same information that you filled out on your submission form for that first box I showed you for whether it's the PI or the research assistant, right? This is where you're going to submit the information for the person who's actually going to want access to the system. So you'll essentially fill all of this out and then once again describe how you intend to use the system. And then that's essentially the submission process, right? Regardless of whether it is a data access submission or a data request to submit data, the process is the same. Once you submit your account, then we do have a data access committee that's going to review that to ensure that, yes, you're at an institution that's doing research that makes sense for what you want to, access the data for, or if you're submitting data, yes, it makes sense that this data would live in the NTRR. That's where this data should live. So that does take a few days because that is members of both the NIH as well as the DoD, as well as myself. So I'll do an initial screening of the request, make sure that all the forms have been, submitted properly. And then I will reach out to that data access committee of DoD and NIH members who are then going to log into the system and review your request to give you approval to the system. So that does take, essentially a week for us to complete that process and then get you access to the system. So that's all I have for the demo. I'm going to now go back to the finish up just a couple more things in the presentation. I see we've got a lot of questions in the chat, and then we'll get to those in just a couple of minutes. So what Center, right, it can do for you, that's, myself and Pam, as well as we have, other staff members that are here to help. Pretty much what we are here for and what the DoD and NIH have us here for is to provide one-on-one onboarding support to make this easy for users. So if you need help submitting your documentation or have questions and creating webinars such as, the one that we're having today to make this as easy as possible for users to adopt. We also support with facilitating data mapping to the existing CDEs. So as I mentioned, you're going to have your CRF. If you're trying to align it with those CDEs, right? I'm pretty familiar with the system, so I could look at your CRF and go through the system and align and say, oh, you want to you want to collect this specific data element. Well, here's a CDE that exists that I think would match for what you're collecting. So I'm here to help with that process. We can also provide data sharing plan template. As mentioned, a lot of funders are requiring you to include a data sharing plan in your application for your grant. So we can help you with that verbiage for submitting that in your grant. We can also help with, we have a data manager estimation tool for grant proposals. So we understand, especially if this potentially becomes a requirement for certain funders to submit data, that, it may take, a bit of a lift to get the data into the system. So there is a tool if you were needing to, let's say, hire a data manager to help facilitate the process of submitting data to the system that we have a tool for how you can estimate that cost and put that into your grant proposal. And then finally, amplifying studies that are uploaded and data that's added. So the idea is that, anyone that adds their data and submits their data to the NTRR, regardless of the environment that it goes to, is that center has a constant contact of over 8,000 users, right? How we let you all know about this webinar today, of, AAST members, East members, OTA, American Trauma Society, right? We have members of all of those different organizations. So the idea is that we can get your, data out there. Others will know in the community that this data is available for them, and they could potentially, utilize that data for further analysis. So that being said, that's the content we have set up for just once again a very introductory, webinar to the NTRR as a whole. From here, we're going to jump into answering some of the questions that have been posted in the chat. I see we have quite a few comments, and Pam will kind of guide us through looking at those comments. And then if we have time after those comments, then we can jump into if any others have comments. And we can go from there.
Great. Yeah, let's start from the most recent and we'll work our way back. Dr. Shackelford asked if the data elements in the NTDB and NEMSIS are already the same as the NTRR CDEs.
Sure, that's a great question. So our work groups that were established were encouraged whenever possible to adopt both NEMSIS as well as NTDB CDEs. We in our process of selecting CDEs, if an NTDB CDE existed, it was automatically provided to the users for adoption. There are instances when they weren't necessarily adopted because there was, quite a discussion as to which maybe version of a particular element was, let's say, most up to date. So I will say that there are times when it doesn't align perfectly, but both of those resources have been thoroughly used in the process so far, and there is definitely room to adopt additional NTDB and NEMSIS elements as we move forward because we understand that those are so widely used by this community.
Okay, another question, Nick. Do we need local IRB approval before we are granted data?
Um, For IRB approval for submitting data, yes. For accessing data, that's something that comes down to who your quote unquote signing official is at your institution. Um, what I would recommend, because each institution is a little bit different, is to go to who you would ever go to for kind of IRB approval and see, kind of share that form with them and talk about what data you'd be trying to gain access to, and see if you just have a very specific person who says, yeah, no, this is the person who would normally sign off on, IRB approval. That might be the same person. But no, we don't need an IRB approval from your institution to access data.
Okay. And is the data submission form the same? Does that serve as the data use agreement?
Yes, those are one and the same.
That's what I thought. There was a question particularly about pediatric trauma and whether this is usable. And I know that we're talking with some organizations about helping them specify elements in those particular environments of care, pediatrics, ortho trauma,
Hmm.
penetrating brain injury. So
Yeah.
my answer was that we'll be working on that and we'll be happy to work with any organization or
Hmm.
group of researchers that would like to specify data elements in their
Yeah.
particular area.
We do have some data elements that absolutely are adult, and pediatric, you could use them for either. But Pam is correct. We don't have we haven't had a work group that specifically looked at pediatric specific elements.
Mhm. I did notice there was a pediatric filter probably in FITBR. So
Hmm.
perhaps they have specified some pediatric specific.
They absolutely have every single data element that gets submitted to the system. There's an attribute for that element where you can mark, is this an adult, element? Is this a pediatric element? Or is this, adult and pediatric? So it's definitely something that we can track in the system if you're looking for pediatric specific.
Okay. Here's a question. Are there checks or rules for standardizing the methods of collection for CDEs? So if two studies share a data element, what's the guarantee that they're both collected using the same tool or method?
Yeah, we don't in terms of the data collection. Um, each CDE, of course, has a very standard definition of when that it's being collected. So a lot of times that helps. The permissible values also help really refine how it's collected. The permissible values being, if we're looking at a simple example is, race and ethnicity, like what's the list of race and ethnicity that a user can pick from, right? Those would have to be the same, right? That's defined in the CDE. Um, we do have instances where most CDEs, what we try to do is we try to also create a recommended question. So like, this is the text that we recommend you use to ask the question. Not every CDE has that because sometimes it's not really a question that you can ask, right? Directly to the patient. But we try when possible to add as much specificity as possible so that data is collected, as in the same way as close as we can.
Mhm. And Dr. Drabeck was hoping that we'd show a sample patient to kind of see what the CDEs are in the NTR database. We probably don't have time to do that now, but that might be a good second or third webinar.
Absolutely. There's so much depth to the system. We can definitely add that to, top priority for next webinar so that others can get a real look at what the data looks like in the system.
Yeah, we didn't want to scare everybody right off the bat. It's very deep. And there's a question about being able to meet with someone outside of these webinars, and absolutely, Nick is always available. Um, I'm going to allow people to unmute themselves if they have additional questions. Nick, you might want to stop sharing your screen so you can see if anybody has
Sure,
their hand up.
sure.
This was great. Thank you
Um,
very much.
Last thing, I just want to put, I'll bring this up at the end as well. I just wanted to put, if you have any questions moving forward, as you said, we are completely, available for you. Here's my email, nick@nattrauma.org, which will go directly to me. And then we also have just kind of a general operations email, which kind of goes to the whole team. So, either works by any means. I'm 100% on this project. My goal is to help support, you all as best as I can. So, um, sorry to interrupt. I think Dr. Shapiro, you wanted to ask a question or
No, just
some
complimenting. That was awesome. Thank you very much.
perfect. I'll stop sharing and by all means, anyone else who'd like to unmute and has questions.
Um, Jen Hagan asked if there's a work group currently formed to do the um, orthopedic MSK. I don't know what MSK. Oh, musculoskeletal. We've been talking with them. We've been in conversation with them for quite a while. There's a research committee, I believe, but we haven't started that yet. So Jen, if you're interested in working on that, we would definitely put you in touch with those folks.
Yeah, Dr. Slobojin, I believe, is very interested. He has been working at OTA, internally at OTA, and with the members of OTA to see if this is a resource that OTA can potentially use, and then also further develop, of course, with a work group to look at orthopedic specific CDEs.
Perfect. He's an excellent researcher. I work with him on other things. I'm actually a member of COT as an OTA representative. So I think there are a lot of people on the orthopedic side that would be interested in this.
Awesome. Yeah, he's been a great member. He's just got added to our is it our scientific advisory or stakeholder, Pam? He's got added to one and he's been very involved.
Stakeholder,
Yeah.
stakeholder advisory. And we do exhibit, in the next 2 years, we've received, I don't know if Nick, I might have missed it, if you mentioned our funding from the Department of Defense, but we have been extended a 2-year contract to basically help everybody get into the get in. And so we're exhibiting at meetings. We will be at AAST, we'll be at MHSRS, we'll be at East. The Pediatric Trauma Society is actually on our radar, so we're allowed up to 3 kind of specialty meetings a year. We'll be exhibiting on the NTRR. We'll be just educating as many people as we can and helping as many people as we can while we have the funding to do so. Ariana Johnson, is there a way to understand what data points exist and what capacity prior to applying for access?
Absolutely. I could either share or I can just put, Pam, do you just want to put the website in the main NTRR website in the chat? Since that's the only other thing was we had the link in the presentation. That's the site there. And if you go to data and then you drop down, we have what a link that says trauma CDEs under the data tab. I could go back there again if you'd like. That's where you can look at them. And then we're really working on making that data dictionary. Right now, the data dictionary on the main page of the data has literally all the CDEs from both systems. So before the next webinar, we'll have that where we can just look at NTRR specific, but working with the programmers on that now.
These are great questions. Well, if there are no more questions, as we said, we will make these slides available. We will be putting this recording on our website and on the NTRR site, and we will be bringing you more webinars with deeper details on the system. So thank you all for attending. We really appreciate your attention, and we look forward to seeing you at the next one.
Awesome. Thanks, Pam.